introduce the motion.
Gurmagat Ceann Comhairle. Do I need to move the motion? I move the motion. So Gurmagat Ceann Comhairle. Meetings full of tears, full of pain, distress, trauma, meetings full of hurt, sorrow and anger, full of women's grief for the lives that they could be living, should be living, if it wasn't for the ordeal of a cruel condition, endometriosis. Last Ceann Comhairle, that was the overwhelming atmosphere in each of the 9 public meetings we held across the country. Meetings attended by thousands of women and their families who bravely shared their stories of how suffering from endometriosis and the absence of proper treatment in Ireland has ravaged their lives. More than 40 of these courageous women and their family members are here in the public gallery this evening, and they are most welcome. And despite everything that they've gone through, they are ready to fight for the health care that all women and girls of Ireland deserve, and to say with one voice, enough is enough. Minister, endometriosis is a crisis in women's health care. It affects 1 in 10 women. Endometriosis, therefore, is in our lives, in our families, in our communities. It's our mothers, our sisters, our daughters, our grandmothers, our aunts, our friends, our work colleagues. It is us. A chronic inflammatory and whole-body disease that affects the pelvic region, uterus, fallopian tubes and cervix, and it can spread to the bladder, bowels, lungs and even to the brain. It causes persistent, excruciating, debilitating pain, pain so intense that it can leave young women confined to wheelchairs, to bed, missing work, missing school, having to give up work, forcing them to drop out of school. It upends lives, ruins lives, puts the lives of women and girls at risk. The story of endometriosis in Ireland is the story of women denied proper care and treatment, suffering in silence, forced to travel abroad for treatment if they can, and even though it's a race against time, women left waiting an average of 9 years for a diagnosis. So women told us of their experiences of not being believed, being told it's all in your head, being told this is just how it is, that the unbearable bleeding and pain is just part of being a woman, just part of a normal menstrual cycle. Being told to woman up and sent home with a hot water bottle and a couple of Ponston. Women and girls ridiculed, sidelined, shamed, just for seeking medical help. Last Ceann Comhairle, I have been in public life for a long time, but I have never ever been at meetings so raw with anguish and anger. Women sharing their most intimate stories of trauma, hoping to be heard, finally heard. Young women whose condition got so bad they lost their wombs, left with no option but to have hysterectomies, robbed of their chance to become a mammy. Women who stood up and told us that the pain of labour and childbirth without an epidural or any pain relief was a walk in the park when compared to the pain of endometriosis. A mother sharing her story of the night when she again is taken to hospital by ambulance because the pain had become so bad. And even though she was in agony, all she can think about is her young son saying, "Mammy, I don't want you to die. You're the best mammy in the world." And all she wants to do was to hug that child and tell him that he is the best son in the world for being so brave for her. Women are at the centre of this crisis, but endometriosis attacks the whole family. It impacts on children especially. Women told us about the heartache of leaving their children behind as they're forced to travel out of Ireland to seek diagnosis and treatment in London or Athens or Bucharest. And it is the incredible love and solidarity of families that has held these women up when they have been so badly failed by the state, as endometriosis gnaws away at their bodies and at their lives. Held up and supported too by such brave advocates like Kathleen King, Kate O'Connor, Vanessa Waldron and others. So, Minister, it is unacceptable that women's healthcare is still at the bottom rung of the ladder. And tonight, we bring this motion and we are here to say enough is enough. Tonight, we break the silence together. And we are standing together to demand that government deliver a gold standard, multidisciplinary centre for the treatment of endometriosis here in Ireland, because no such service currently exists, so that women and girls are diagnosed quickly and early, get the medical interventions they need, including specialised excision surgery when required. And it is beyond disappointing, in fact it is enraging, that the government, with a shameful amendment, pushes back against the first-hand experiences and real trauma of women. By deleting our motion in its entirety, you attempt to delete the women's and girls' calls for better. It's a shocking amendment, Minister, and it is seen by all of us here as exactly what it is. Because you see, women who have had access to the correct treatment have told us what it means, that they feel reborn, that they got their lives back, that they shared the joy of being part of the lives of their children and their families again, that they could work again, that they could breathe easy again. That is what is at stake. That's what real action on endometriosis can give back to so many women and their families. Curran in Vétros is Jack Banawan asgach Dechnor. Tá an stát ag éoch ar bhaná atá fóga ag folinch, cróite ag Eunice, in Nonantas Coram, Cahi sé seo a ahrú. Ordinary women from across the country flock to public meetings. Women from all walks of life brought together by one thing, endometriosis. Meetings raw with tears, suffering and trauma. But meetings that were also filled with resilience and strength, with determination, with love, with determination to achieve a turning point for the treatment of endometriosis in Ireland, to say no longer will we be ignored, no longer will we be sidelined, no longer will we suffer in silence. And the women in the gallery, and tens of thousands of women at home who are watching on, they are strong, they are united, and they are not going away. 1 in 10 women, that's what this is about. Their health, their futures, their very lives. That's what's on the line. And the government must now finally hear their call, hear and respect their experiences and suffering, and then respond, and respond now.
Minister, Sinn Féin held 9 public meetings on the issue of endometriosis over the last number of months, and I attended some of those meetings myself. And I have to say I was shocked when I heard a lot of the stories that were told by women. I listened very carefully, and I watched many of them as they cried in the presence of family members. The collective trauma in the room really just caught me by surprise. And I have to say that the message from these women of feeling ignored, of feeling dismissed, of being offered substandard care, for me was truly shocking. What was also shocking was the amount of women who told me that not because of choice, but because of necessity, they had to travel abroad. There was a 27-year-old woman who had 3 surgeries, one of them in Ireland, and then had to travel to London for a radical hysterectomy. And most of her, a lot of her organs were unfortunately taken out, and it was a really traumatic experience for her. And the very same women, 40 of them here in the public gallery, were in the Sinn Féin party room earlier on, and I got chatting to some of them. And I have to say, they did find the amendment that was moved by yourself as offensive, because nowhere in the amendment, Minister, does it really capture what these women feel. It doesn't capture the substandard service. It doesn't capture the fact that there is no pathway for a diagnosis for many women. It's too late in many cases. There can be misdiagnosis, mistreatment, substandard care. And what was really galling for them was the part where it says that women, as a choice, can travel abroad. We've had far too much of that when it comes to women's healthcare, and it is not a choice for these women. And they felt heartbroken for those women who travelled, very often travelled on their own. In some cases might have had 1 or 2 family members with them. It isn't for a day or a week even that some of these women are away. They can be away for 3 weeks, 4 weeks, even longer. And no woman should have to go through that. No woman should have to travel abroad. I met with and I spoke with masters of hospitals. I met with specialists who deliver this service, and all of them put their hands up and said that we are not providing the care that we should. There is an awful lot more that needs to be done. So, Minister, I'm appealing to you when this motion is finished and this debate is finished. Go and talk to the women in the public gallery. Hear their message, because if you heard their message and listened to their voices, I guarantee that you would do everything possible to provide the centre of excellence which is needed, to make sure that we have specialist training programmes, to train the surgeons, to train the specialists, to provide the gold standard care, the excisions which are necessary, as opposed to some of the substandard treatments that these women are getting. And as a male, can I finish on this? I stand with these women. Men and women in this House need to say enough is enough. We have to do more to support women with endometriosis, and I would encourage you, Minister, to not move your amendment and to support our motion.
Deputy Doherty.
Minister, the neglect needs to end, the failure needs to end. Endometriosis affects so many women, and like others, I've been attending meetings across different parts of this country, and I've heard some harrowing stories. But there's also a constant theme in all of it. No matter where you are in the country, it is that they feel that they have been abandoned by the state, and they have. They feel that they've been ignored, dismissed and talked down to. But there's also in those rooms stories of imaginal strength, determination, as they told us how they fought for years for what should be basic health care. A young woman from my own county in Donegal shared her story with me of her experience of trying to access endometriosis health care in Ireland. Having experienced symptoms since she was 15 years of age, she attended her local GP and Letterkenny gynecological department, only to be told that there was nothing wrong, but the pain never went away. She had MRIs, she had ultrasounds, she got a referral to urology, where she had a cystoscopy, and it was carried out, subsequently clear. She was told everything was okay, and still the pain never went away. After years of living with that pain, in 2021, she was prescribed antidepressants, and she was told it was all in her head. And still, the pain never went away. And imagine desperate for help, desperate, reaching out to the professionals and being told that you were making it all up, it was all in your head. She went privately for an exploratory laparoscopy at the cost of €4,000 to her, and no endometriosis was found. She was told she needed to change her diet, she needed to change her lifestyle. It was her again. Knowing that the pain was still there, knowing that there was an underlying issue, and not willing to give up, she went again privately to another gynae, and they agreed that the symptoms were consistent with endometriosis, but they were reluctant to operate. She had to reach out again and again and again. She spoke to other people with the same challenges, and she finally decided to travel to Romania in 2024, where she finally got the answers that she deserved. A specialist MRI diagnosed her with endometriosis. That is a diagnosis, Minister, that took 9 years. 9 years of not being listened to, 9 years of not being believed, 9 years of misdiagnosis, 9 years of pain. In going to Romania, she faced more difficulties. Her GP wouldn't refer her in terms of being able to recoup her costs through the cross-border scheme. So once again, she had to go private for the referral. And after she got that diagnosis in Romania, and after undergoing counselling due to the lasting effects of this journey on her that she had to endure, she had surgery in Greece, where the endometriosis was removed from multiple sites, and she was also diagnosed with adenomyosis. And for a decade, that young woman suffered with chronic pelvic pain, chronic fatigue, underlying issues, bowel issues, back pains, countless other systems, and nobody believed her. And that story isn't just hers, it is far too many women right across the state, and this needs to be treated like the emergency it is. Too many times women are being failed. Too many times they are not being believed. Too many times they have to travel abroad, and it has to come to an end. There are other stories I could recall to you. A story of another woman, again failed by the system in this state, had to travel privately outside, and she got her diagnosis. She was told there were cysts in her ovaries. She cried, Minister, but she didn't cry because she needed emergency surgery. She did not cry because she had cysts in her ovaries. She cried because for the first time somebody believed her. For the first time somebody believed that she had endometriosis. Somebody believed, and that there was a plan in place for her afterwards. This has to come to an end. I said at the start, the neglect has to end, the failure has to end. We need to start listening and believing our sisters, our mothers, our aunties, our nieces, our daughters, and we have to put the care that they deserve in place.
Deputy Farrell.
For too long, and I'm sure you agree that for too long women's health wasn't discussed. It was seen as something that was secretive or indeed embarrassing. And I think that as a result of that, we've had a situation that for decades women's health care has been totally and utterly neglected. And this isn't exclusively for women with endometriosis, it's been for a whole range of things. But this needs to end. And Minister, especially as you're a woman, I would appeal to you to see what this motion says, what these women have told us needs to be done. And it's coming from the expertise of the women that are around us here today. I'm conscious of time, but what I want to do is relay one lived experience of women, because I think of a woman that had contacted me. This woman now has stage 4 endometriosis. She was diagnosed in March 2023 at 36 years of age, having suffered terribly with this illness since she first got her period at the age of 11. She was in and out of hospital, suffered loads of misdiagnoses, and even was told that it was muscle pain, or she said some rubbish like that. Minister, I ask you to listen to these women.
Deputy Byrne.
Minister, in May I hosted a public endometriosis meeting in Drogheda. Since then, my office has been inundated with women contacting me by phone, email and in person. Gemma is one of these women, a 32-year-old nurse from Louth, and she has asked me to briefly share her story with you. My symptoms of endometriosis were prevalent from the first period I had. The bleeds were heavy, excruciatingly painful, causing me to regularly miss days of school. I had scans, there would be cysts, I would be sent home and told to take more pain relief. I would vomit, faint from pain, and I was told that this was normal and part of being a woman, so I grew up believing this was the case. Working as a qualified nurse in Dublin, my symptoms worsened and I paid privately to see a gynaecologist. During this appointment, I was told I was too young to have endometriosis and a D&C would probably fix me. This was a completely unnecessary procedure. I moved to London for work, saw my GP and was booked in to see the gynaecology team at a specialist centre. Only then did I receive my diagnosis and suddenly my life made sense. I'm almost 8 years into my diagnosis. I've had multiple extensive surgeries. I've completely lost the function of my bladder and I've been catheter dependent since 2019. My bowel stopped working a year ago and I needed urgent surgery in May of this year to create a stoma. I'm under the care of a specialist pain team, receiving infusions every 12 weeks to help me manage my pain. I regularly need admissions to hospital where I am treated with dignity and care over here. I'm now on the waiting list for another surgery which will be more complex and will involve the urology and colorectal team. In March this year, due to my illnesses, I had to leave my job as a clinical nurse specialist nurse. I would love to move home and have more support from my family around me, but this is not an option without the adequate healthcare women require in Ireland. Gemma is the voice tonight for the women in Louth and the women in Drogheda that have contacted me. I commend their bravery and thank them for their courage and trust in us to be their voice. But government need to listen to these voices tonight. Riley. Government need to end the suffering, end the silence, and shame on you all if you don't.
I'd like to welcome all the endo warriors who are with us and their families. I want to commend them for their fight I want to commend them for standing up, and I want to also offer my sympathy to them because I know that many of them came here tonight in pain. Minister, you know you should withdraw the amendment. You know that it is wrong, but just in case you're under any illusions, I spoke to these women, and these are the words that they use to describe your amendment. They call it sickening, they call it inaccurate, and they call it insulting. So press on, Minister, with an amendment that is sickening, inaccurate and insulting, if you will. But know that as you do that, you do it to the women in the gallery. Minister, I was diagnosed with endometriosis when I was 24 years of age. I was lucky because I got an answer to what was wrong with me, or I thought I had, why I was always in so much pain every month, why my husband had to lift me up off the floor when I was crippled. I went to the doctors for help, I went for assistance, and I was gaslit, Minister, gaslit. Bit like your amendment, I was gaslit. I was told, would you have another baby? Would you chance another baby? That might help. Do you know what? Would you give the Marina Coil a go? Sure, that might do something for you. Well, you know, is it uncomfortable? Is it uncomfortable? No, it was bloody agony, and I will never, ever forget the way that they made me feel. And I shared that experience because it is a collective experience. Minister, you know that your amendment is wrong. You know that it is shameful. You know that it is sickening and insulting. And you know it because these women are telling you. It is shocking that almost 30 years later, precious little seems to have changed. Minister, withdraw your amendment, work with the opposition and deliver the care that these women need and deserve.
Thank you. Minister.
The first thing I want to do is thank you for the work that you are doing with and on behalf of women. It is wonderful to see so many different parties, so many different voices, male and female, articulate the female health experience, because every single person here knows that it has been overlooked. Every single person knows that experience of telling a story and not being listened to and not being believed. I completely respect those experiences, and I have no interest whatsoever in engaging in politics around something as important and as serious as this. What I am interested in is service delivery and the quickest possible way of ameliorating and fixing and making good the sheer lack of service delivery for women's health that has been there for so long. There have been important advancements in the last 5 years. There is an important programme happening now, which is a different way of listening to and respecting women. I can't make up for the previous experience, but what I can say is, as the first female Minister for Health for a very, very long time, I have a very, very strong commitment to delivering services that are going to make a difference in people's lives. We can deal with the technicality and the politics of an amendment and how that works. You are welcome to make whatever charge you wish against me. I am not here for that. I am here to take steps forward on service delivery, to make some description about what has happened, to discuss what needs to happen next and how we might deliver that. And I just have no interest in politics in relation to it. I am only interested in service delivery. I will, of course, answer the women as to the technical pieces that we have. But thank you for coming tonight in relation to motions and amendments and how that works. But I really am interested, as first female Minister for Health in a very long time, who, by the way, also has friends and families and constituents describing to me the pain in their lives, the pain in their bodies that they are living with and have lived with for so long as a consequence of endometriosis, and in particular undiagnosed endometriosis, and what that does for their mental health as well. So I share all of the stories that you have told are so important that they are told on the floor of the Dáil. They are, with every respect to you, and you will know this, stories that I have also heard and heard already, albeit from perhaps different women, but nevertheless precisely the same experience. I never ever deliver the speech that's delivered, so it's welcome to be there, but you know that I don't deliver it, and it's a matter of courtesy what's prepared. Deputy, as I said, I'm not here to politicise anything. You're welcome. I don't critique you. Would you like? I tell you what, I'll address the women in the House. What's important for us is actually making progress on endometriosis, and there is some that's happening. First major difference that we have, and this does not account for the many years of underinvestment and under-recognition of women's health, is that we do have a dedicated women and infants health programme. Now, that has made some difference in relation to how maternity services are conceived. We have more work to do there. Some difference in relation to how menopause services are conceived, and we have more work to do there. And some difference in relation to endometriosis, and we have more work to do there. We know, of course, that endometriosis is one of the most common gynecological conditions. How this was under-recognised for so long is literally beyond me, when there are so many women presenting with such consistent symptoms. But we know and we recognise it, and while our motion doesn't go through the physicality of that in the same way that the Sinn Féin motion does, I totally understand that. I totally understand that. There are a huge range of very, very difficult symptoms, and there's also asymptomatic endometriosis, but there is a different spectrum of experience. And the divergence is important that we listen to all of those experiences, but it's also important that as Minister that we're responding to that complete spectrum of experience, some of which can be responded to at GP level and others need specialist intervention services, and I have to try to make sure that all of that is there. Now, since 2021, we have invested over €5 million to expand specialist endometriosis services to provide treatment for women with moderate and complex endometriosis, and there's an additional €2 million this year to continue to do that. So far, that investment has led us to being able to recruit nearly 25, it's 24.6 whole-time equivalents, 24 and a part-time person equivalent staff, and we have the funding. The specialist services are expanding further with the HSE recruitment process to recruit another 18.6 people, another 18 people plus a part-time person, with the funding provided this year. So we are more than halfway through that recruitment programme, and there's no question about that. That's for some of the specialist services. Most endometriosis, particularly at the less severe end, and I appreciate many of the people here are perhaps at the more severe end, but at the less severe end, most of that care can be provided with GP care. But that requires GPs who understand endometriosis. It requires GPs who listen to women who are presenting with these symptoms. And it requires having this dialogue in public, which is why what you're doing is so welcome, to be able to tell this story as broadly as possible, as many women have been doing for many, many years. The moderate, however, and severe cases of endometriosis may require, in my view, but it's a clinician decision, referral into the specialist model of care. Now, at the moment, as you're aware, there are two, one in Dublin and one more recently in Cork. And I visited the Cork one, and I've spoken with the nurses and doctors there. I've spoken with some of the patients there and understood their care pathways and where that has yet to go. There's also 5 regional endometriosis hubs, as many people will be aware, but for those who are not, in the Rotunda, in the Coombe, in the National Maternity Hospital, in Limerick, in the Galway, and in Lee Road in Clinic. Now, they're all operating. They're all taking referrals. Women are receiving care through Galway and the maternity hospital, and there's more work to do on the structuring of those clinics. GPs, we now have clinical guidelines in relation to this, and GPs are encouraged to initiate treatment for suspected endometriosis. They can refer and are encouraged to refer suspected cases through those different pathways. And that's sounds all very clinically led, and it is, but the point is it's about the visibility of this condition in GP services, in GP surgeries, so that they know that there are pathways here where more complex cases, which can be progressed. I understand that there was well over 1,100 new patients seen in 2024, and that on average, only 72% of those women were seen within 6 months between August and December. We have more than 300 specialist surgeries that were provided between August and December last year, and another 200 in the first 3 months of this year. Now, I know that there's more that needs to be done in relation to that, but it is also important for me to put those facts on the record of the House here. Women with endometriosis may also be on other gynecology waiting lists, and that is also important. We've had a 108% increase in general gynecology referrals over the last number of years. And again, in part, I hope that this is some recognition of women presenting with their conditions and being listened to about their conditions and being referred onwards. But I can say that although there has been very significant investments since 2021, it has enabled twice as many women to be referred to our gynaecology services, with more than 80% of women waiting less than 6 months. As a woman, that's still not enough. It's still not enough. I have been Minister now for a number of months. I have visited Cork. I have met with women suffering, and I mean really suffering from this condition. And there is an awful lot more work to be done. We do have see and treat gynaecology clinics that essentially walk into and be treated immediately. Those are really having an impact. And I'm hearing from women there, they are making an impact on waiting lists. They are making an impact on women's lives. They're being seen and treated at the same time. And there is work in relation on related issues. But let me just address the national framework. This is something that for the first time in Ireland we have this defined clinical pathway for women with endometriosis at the highest level expressed in a national framework for endometriosis. We are not finished with it yet. There is a body of work to be done to agree with GPs how they will fit in and how they will be part of that. And that is not yet complete, not yet finished. And there is more work to be done there. It is in discussions between the HSE and the Irish Medical Organisation, who represent the GPs, and there is some more work to do. And I would love to be in a position to update the House in relation to that in the next while. There is also important diagnostic criteria for endometriosis that are determined by clinical specialists, but I don't have time to get into those, and I do want to address the particular the question around motions and how they're dealt with. And I appreciate that Sinn Féin will disagree with me, as is their right and their entitlement. But in any event, what we take the opportunity to do is to set out the different things that have been done. I don't reject any really of the points articulated by the women here. What I do is we take a slightly different policy direction in one respect, which is that instead of one centre of excellence, we have decided to do it more regionally to reduce the amount of travel, to make sure that there's an opportunity to get more regional care. We also recognise then, in the motion, we try to set out what has happened, what has yet to happen, and to recognise that there are different, and I mean, you have raised about private treatment and choices. Women are entitled to choose. I want them to be treated within the public system. I will finish. I want women to be finished. I want women to be treated within the public system. I want to make sure that women have every option to be treated in the public system.
Thank you.
But where a woman has gone abroad, she must be supported when she comes back to Ireland, and we have to set that out in the motion.
Deputy Natasha Newsom-Drennan. Deputy, it's not your. This is. There's a sequence in the format. Deputy Newsom-Drennan, please.
Can I thank the ladies for sharing their stories?
I'm
welcome
sorry,
them,
Minister. Ladies, deputies.
I have it.
Deputy Newsom-Drennan is on her feet. Minister, please resume your seat.
I want to commend my colleagues in Sinn Féin, and especially to Senator Marie McCormick, for her outstanding work in raising awareness about endometriosis. Minister, if we ever needed a clear-cut example of how women are treated as second-class citizens, we need look no further than the treatment of those suffering from endometriosis. Despite 1 in 10 women having this condition, there is currently a 9-year delay in diagnosis. This allows the disease free rein to spread, causing irreversible damage to organs. 3 weeks ago, Senator McCormick and Deputy Cullinan and myself hosted a public meeting on endometriosis in Kilkenny City. Dozens of women attended and shared their personal battles with the disease. That meeting gave a glimpse into the immense suffering endured by so many. Far too many women across Carlow, Kilkenny and across the state are suffering in silence. Repeatedly, we heard about the delayed diagnosis, misdiagnosis, inadequate care and denied access to proper treatment. These women spoke of Ireland's utter lack of treatment options and the devastating impact on their personal lives. I heard from one mother whose teenage daughter has been forced to drop out of all sports due to the crippling impact of the disease. There are countless teenage girls across Ireland whose parents are being told by doctors that it's all in their head. They're blowing it out of all proportion, that it's just something teenage girls go through. Minister, these outdated methods from doctors are an insult to women of Ireland. They are devastating the lives of these young girls and resulting in high rates of absence from school. Not only do we need adequate treatment, but we also need awareness in schools across Ireland to ensure teenager girls are not suffering in silence, that they know that they are not alone, that there is support. One thing that has echoed in the voices of the women in the gallery: they do not want to travel abroad. They do not want to have their operations or treatment. They want to have them here in Ireland.
Your time is up.
With support from their families. Now that we finally have a female Minister for Health, I implore you, woman to woman, please implement modern, fit-for-purpose treatment for women across Ireland, because for far too long women's health has been treated as an afterthought by your side of the House.
Deputy Thomas Gould.
Good morning. Minister, there are women and girls in the gallery tonight. I spoke to some of them earlier and listened to their stories. I was in Cork a few weeks ago where I attended a meeting where people told their stories. They were horrific, Minister. And Minister, here I am now, a man 6'5", talking about women's health and women's period pains, and I have no idea. Minister, I'm asking you, because I think you're a decent person. Don't let the bureaucracy, don't let the department, don't let men in this government tell you about putting in an amendment. You should be backing this amendment wholeheartedly. You should be leading the way. These people want you to lead the way. As a woman, as a Minister for Health, you have the ability to do that, Minister. And I would implore you to do it. There are girls who've given up sport. There are girls who can't go into school. There's an education that's needed here. There are girls and women who can't go to work every month or are out of work for long periods, who've lost their jobs, who've lost their friends, who've lost because they haven't been able to go to things, they haven't been able to socialise, and they've been trapped in their rooms in pain. So, Minister, for all these girls and young women, what we're proposing tonight doesn't come from Sinn Féin. It comes from all these people up here who live this every day and their families who live it. I'm asking you to withdraw your amendments and to run with this bill. Minister, there are things where politics, we politically disagree on a lot of issues. In this issue, can we not come together? Can we not park the politics and say for once and for all, let the women of Ireland be listened to, because for far too long they were sent home to suffer in silence, but no longer, Minister.
Deputy Donick O'Leary.
A meeting that Deputy Gould was at, and going to political meetings since I was 17 or 18, and I've never left a meeting more shook than I was by that meeting. Some of the stories would make your blood boil, they would break your heart. The accounts of the pain, and I think most of all, I think most of all, on top of the pain and the suffering and the grief in some instances that some of the women were suffering, the attitude that they received from medical professionals, in some instances dismissive, in some instances careless, in some instances just frankly heartless and lacking in compassion completely, totally dismissing what these women were going through. Minister, we disagree on a great deal. It seems we disagree in the approach, in the policy approach, but surely, Minister, you have to accept that something is fundamentally wrong. Something is fundamentally wrong when you have so many women who are, I apologise, I'm sure you're dealing with something important, but I am a bit distracted now, to be totally honest. Because I do want to address you, because I am really appealing to you that the attitudes that are being encountered, just so dismissive. So it's as if that nobody in the medical profession, or that a large section of the medical profession was unaware, or that this was a new disease or a new condition, and that there wasn't a knowledge of what the best kind of treatment was. And you know, you've spoken yourself in the past quite forcefully, I might add, in relation to us exporting issues in terms of women's health. That's what's happening here as well now. That is what's happening here as well. And I've had instances where women have struggled to get the money that they've expended back, and that has been a difficulty. So, Minister, the attitude that is there needs to be addressed, but there is also a systemic issue. What these women are facing is simply not good enough. And I urge you, look, there are differences of opinion in terms of approach, but I am urging you to take this on as a key priority, because what's happening is absolutely shocking.
Isn't good enough. It's as plain and simple as that. It is not good enough. If you heard the stories of all of those women here today, I am proud of my party colleague, particularly Senator Maria McCormick, and my party president, MaryLouMcDonald, for bringing this motion to the House, because it would never be brought to the House by government. Since the beginning of the Sinn Féin campaign to achieve adequate endometriosis services, I've spoken to many people from Mayo who are suffering with this debilitating condition. Women tell me, you paint this picture, but women tell me they cannot live with this pain, and they're sent to the mental health services. So if the picture you are painting is correct, why are they sent to the mental health services? I particularly want to welcome Sinead Conlon to the gallery, and her dad, Dermot, all the way from Mayo this evening. And I want to tell you in Sinead's words, and I want you to look her in the face when you are giving your response to this. I was never listened to as a teenager, and it took until the age of 23 to be referred on to a specialist who advised me to have a child, and this would help the problem. After having surgery here in Ireland for endometriosis and taking the advice, I was still left in horrific pain every day. No help, no advice, and left completely hopeless. No income as a self-employed person. How am I supposed to live and provide for my child? The pain I experienced every day was all over my body, and it's unbearable. Daily tasks are now impossible, mentally and physically. It is so unbelievably difficult. This has been a long battle, and going abroad shouldn't be the answer, but it's something I have to do now. I'm being exported. We should get help here in Ireland and not be ignored. Only for I have the support and help from my family financially, I wouldn't have the option to get help abroad to end this torture. Michelle, also from Mayo, who wrote to me today saying, I was meant to be going for surgery to check endometriosis, but instead they just booked me in for a scan last week and cancelled the surgery. They admitted I probably do have it, but offered no other support. I have an autoimmune condition. This is causing health problems, and I am now more nervous than I've been. Also, it's spreading to my organs, especially to my bladder and my kidney, and as I have had problems before. This is what's happening to women. This is what's happening to the women in the gallery tonight. Minister, your response is not good enough.
Thank you, Deputy Marie Sherlock.
And I want to sincerely thank Sinn Féin for this very detailed motion this evening, and I think when we look at the detail and the very specific calls that are in this motion, Minister, it behoves us all to look at how women, and particularly teenage girls and young women, are being absolutely failed in this country. When I rise this evening, I think of the conversations that I've had on the doorsteps over the past 4 years, women who have had to muster up such courage to just say on the doorstep, please speak up for me. This is what I'm going through. My life has been upended. Their work, their education, their friendships, their family, their sport has been upended because of a condition that very few within the health service take seriously in this country. And I must say, when I read Lisa Tierney-Keogh, the playwright Lisa Tierney-Keogh's article last weekend, you know, I reflected, God, should I actually put any of my thoughts on the record this evening? Because really, in terms of that gripping, devastating account of her life, tells all about how women have been failed in this country, those suffering with endometriosis. She and, of course, so many hundreds of others have been continually gaslit. They've been told they've been hypochondriacs. They've been dismissed. And that goes on to this day. And I think there's a perspective in this country that the days of dismissing women, that has somehow
the Ireland of the past. It's not. And I know that there's so many women in this gallery today whose daily lived experience in terms of their interaction with the health service is that, and that needs to change. And while, to be fair, a lot has been said about endometriosis over recent years, and there have been some actions taken. The actions that have been taken have been far too patchy and inconsistent as to provide a comprehensive and proper service for all those suspected of suffering from endometriosis in this country. So I want to raise a number of issues this evening. The first is with regards to this so-called distinction between mild and severe cases of endometriosis and who determines that. Because firstly, we know that the diagnosis of endometriosis only happens when there is a surgical intervention to diagnose what exactly is going on within a woman's body. And I have a very real concern that with the current model of care and current pathways to care, which of course we know the GP will always be the first point of contact, but I am very concerned that women suspected of having endometriosis would remain within GP care, because the reality is that for some people, endometriosis is being contained by putting them on a form of contraception. I had a woman today tell me she was put on the pill at 13 and told, away you go, you'll be fine now. A mother told me that her daughter at 16 was put on the coil. And by doing that, it contains the symptoms, but masks the need for that comprehensive and fundamental treatment that ultimately is required. Because we know that it's not just about helping with the incredible pain, the debilitating pain, but also it is about the long-term injury and damage to a woman's body with the ongoing effects of endometriosis as they get older. And there is a reality here that we have to make sure that women, if they're suspected of having endometriosis, that they are directed into the specialist hubs that have been established. But to those specialist hubs, and look, they're very welcome that we now have 5 specialist hubs. But the reality is, of the 50.2 whole-time equivalents, only 24.6 are filled. And not only that, but in the 2 big centres in both Tala and in Cork, the reality is that for the Munster region alone, that we've only a third of the staffing in place. Now, I know, Minister, that efforts are made to try and recruit accordingly, but the reality is that for those even in place, that they're not working full-time on those multidisciplinary teams are not working full-time to those hubs, but are also having to work in other areas of gynecology, urology, and what their other specialties are. And the reality is that we need a full-time, dedicated set of teams across this country working on these services, because, to be frank, we don't have that specialist level of care even within those hubs. The other key issue that I want to raise this evening is with regards to the treatment abroad scheme. And I think it is reckoned that there's about 100 to 150 women travel abroad to Romania each year for specialist endometriosis surgery. And we know that there's women who go to other countries as well. And of course, it's all down to money in terms of who can afford to actually travel because of the transposition of the healthcare directive in this country, that effectively you get the money back afterwards as opposed to the payment up front. But there is another key issue here, that the state does not even have a proper handle on who is travelling abroad for specialist endometriosis treatment. Because when we put forward the question about how many women are travelling for that care under the cross-border directive, we could get no answer, because women are categorised under general gynecology, under pain management, under urology, meaning that the state itself has no true understanding of the volume of women who are forced to travel every year. That has to change. We need to have a handle on how many women are forced to travel and how we can expect then to try and actually look after them here in this country. And I suppose the last point I wanted to make this evening is that this is not just about the health system. This is about the education system. it's about the workplace, and it's about society in general, in understanding what endometriosis is about. And I just want to recall one mother who contacted me, and she talked about how, you know, this is obviously hugely debilitating, particularly for teenage girls. And her daughter had missed well over 20 days in her Leaving Cert year. So this girl, who was very bright but obviously had lost key days in her education, the decision was made by the family, with the specific encouragement by the school, to apply for the DARE programme. So after going through many hoops with the consultant, there was eventually a form signed by the consultant confirming that this child, that this teenager, had missed school days, precious school days, because of her condition. But of course, there's no definitive diagnosis for the condition, because she was undergoing investigations, because they were waiting till she got a little bit older, and because they would need to have surgical intervention. And so they submitted the form, signed by the consultant, but when it went to the Department of Education, it was refused, because there was no formal diagnosis. Now, I find that absolutely appalling, that a civil servant could make a determination as to the health and well-being of a teenage girl who had just done her Leaving Cert, against the very clear advice of the consultant. And that's what's happening, you know, not only in the Department of Education, but right across workplaces in this country as well. Employers not understanding, because we haven't spoken often enough about what is happening to women who are suffering with endometriosis. And that has to change. That has to change through the conversations we're having here, but it has to change in the community as well. So to that specific example of the Department of Education, we have to ask them that what are they going to do to make sure that teenage girls going through this, that they are properly looked after within the education system. And I'll now give over to Senator.
Thank you, and I'd just like to thank Sinn Féin for this really detailed, strong motion that's been presented tonight, and to thank our own party spokesperson, Marie Sherlock, for sharing some time with me this evening. As a former party spokesperson on health, nothing struck me more than the cases of women who come and explain to me the pain, the silencing, the suffering and the exclusion that they felt as women in this country suffering from endometriosis. And when I saw this motion from Sinn Féin, it said everything that needs to be said, because it's focusing on diagnosis. It is when you look at the calls in this motion, they're clear, they make sense, they're step by step. They start imaging protocols, resourcing, awareness training, training for healthcare professionals. It's about cutting the time of diagnosis, those years of being silenced, of all the pain. And then you get the response motion. It's about waiting lists being cut and women not being long on waiting lists. It's taking them, on average, 7 years to even get onto a waiting list because of the delays in diagnosis. So the motion that's been put forward by government isn't answering the motion, the very, very good motion that's been put forward by Sinn Féin. And it is angering. There are women in the gallery tonight who have been crying almost non-stop since this debate has started. Such is the level. Finally, it's having a proper airing on the floor, but what they're hearing and the answers that they're looking for from the government, they're not getting. This is not a usual motion. This is not a usual Tuesday evening. And when we're describing any healthcare issue in this country, any description, and within that description is the line, women are travelling abroad for healthcare, then we know we're getting it wrong. And we're getting it wrong, and we're not doing enough. I would ask the Minister to withdraw her amendment. Let's support the motion that's been put forward. It's a really, really good motion. It makes sense, and it's achievable. Thank you.
I too would like to thank Sinn Féin for this motion and for putting a spotlight on this important issue. I'd also like to commend the campaigners in the gallery. You shouldn't have to be here, you shouldn't have to be sharing your stories, you shouldn't have to be emailing your TDs and laying out your pain. But I commend you for your work and your advocacy on this, and I urge the Minister to take action and ensure that we are in fact here again. It's estimated, as we know, that 1 in 10 women and girls may suffer from endometriosis. It affects women and girls from age 8 to 80 yet endometriosis is misunderstood, misdiagnosed and mistreated condition. These are the words of Endometriosis Association of Ireland. And it's no coincidence that it is women who are being misunderstood, misdiagnosed and mistreated. There is a widespread culture of women's concerns being dismissed, minimalised and invalidated within the Irish medical system. This is a cultural problem, this is an attitude problem, and it needs to change. Women's healthcare for far too long has not been a priority for the state. In recent years, 2 women's health action plans have been published, but they considered largely of repackaged initiatives that had already been announced or already in train. And there's no implementation plan alongside the 2024-2025 action plan. And publishing glossy plans is all well and good, but delivery is key. Minister, you talked about the National Endo Framework. It's now 2 years since the development of the framework was announced. It was due to be published within a year by April 2024. However, 14 months later, and we're still being told that the framework is nearing completion. The same line the Department of Health has rolled out time and time again. And obviously the framework is no panacea, but it's an important step in improving the model of care for endo. Even at the most basic level, it would provide us with proper data on disease prevalence, because what gets measured gets managed. Like others, I want to just share some of the stories that have come to my office in recent times. Last week, I heard from Dr. Rachel Marie O'Connor, a physician who recently underwent life-saving surgery for endometriosis. Like so many women, she had to go abroad for treatment. For a decade, Rachel endured excruciating pain of her undiagnosed endometriosis. She was repeatedly prescribed antibiotics for UTIs, but Rachel never had a UTI. She had bladder endometriosis. When she eventually got an appointment with a consultant gynaecologist in Ireland, she was told that her endometriosis was too advanced for the Irish medical system. The waiting list was 1 to 3 years, so Rachel was forced to travel to Poland for treatment. Once she was there, she discovered the true severity of her condition. Because of a decade of misdiagnosis and mistreatment in Ireland, Rachel's endometriosis had spread beyond her reproductive organs. It turned out that she had been living with multi-organ damage for almost a year, and her organs were failing. In Poland, away from family and friends, Rachel had to have major surgery to save her life. Had her endo been diagnosed and treated earlier, this would have not been necessary. As Rachel said herself, no woman should have to leave Ireland or empty her life savings to receive the care her own health service should provide. Like so many women before her, the state turned its back on Rachel, exporting the problem. Rachel is now fighting to ensure that no woman had to suffer the same fate. She has sent you a concise proposal outlining the ways in which early diagnosis, early recognition and referral pathways for endo could improve if the political will exists. I would therefore ask the Minister to consider the proposals carefully, and it would be great if you could meet her. I also received another correspondence from a constituent, which I'd like to briefly share with you. This is a woman who's just 18. She had been suffering from endo since she was 15. Her pain was often chronic, leaving her bedridden and unable to move. She described it like feeling like her insides were being stabbed. She attended the GP repeatedly over many years, and she said herself what she got was an eye roll and some paracetamol. It wasn't until April of this year that she finally got a referral to a gynaecologist. This is 4 years of debilitating pain in which she missed out on countless days at school and college. When she went to the gynaecologist, one of the solutions proposed to her was she get pregnant to ease her symptoms. This is unacceptable, Minister, but it's the reality of care in this country. Ultimately, Minister, we need the framework, we need better care, and that starts with better understanding of crucial health services.
Thank you, Ciarán Comhairle. I want to thank Sinn Féin for bringing this motion forward today, and I want to welcome everyone into the gallery. Minister, here we go again. Like, at what stage are we going to provide women with the support, with the health care, with, you know, the care and attention that they deserve? We're in a situation where we are failing a generation of women all over again. 1 in 10 women suffer from endo. Like, we're sending them overseas, we're ignoring their symptoms, their pain, their trauma. We're telling them essentially it's in their head, or suck it up, or here's some aspirin, you know, off you go home now and continue with your lives. But that's just not possible. And I think probably the worst part of it is women aren't being believed, just not being believed when they're going to their GPs, or, you know, in crippling pain, and being ignored, you know. And I just can't believe we haven't learned yet. We haven't actually, as a society, as a country, we haven't taken on board all those other previous instances and times where we failed women. And here we are doing it again. I just want to read, a constituent of mine sent me this email, and actually I think her email could far outweigh any speech that I could give tonight. So to date, endometriosis has cost me a future where I could see having a family of my own. I may never be a mother, despite best efforts and emotional, financial and physical stress through self-funded IVF for many years now. Endometriosis has cost me days and days off work from my job, and luckily I have a good employer and I can work from home. I really feel for those that have jobs that will not allow for this crippling disease. I've been ignored and pushed aside for so many years. I pleaded with consultants to believe that I was in crippling pain for 10 days every 21-day cycle. I had 11 days of respite if I was lucky to feel normal. I advocated for myself, I self-diagnosed, I urged consultant to listen to me and to get a treatment plan in place. I've lost an ovary, the disease destroyed my ovary. The disease also nearly took away my bowel. I now live in fear that this disease will take it in the near future. Endometriosis has taken away and cost me too much. I can't attend classes I've signed up to, I can't attend birthday parties, weddings and family gatherings a lot of the time. I had to tell, I told you so, when the consultant debriefed me after my surgery to tell me how scary the surgery was and how badly ravaged my insides were. I look normal and healthy from the outside. I vomit with severe pain before I join work calls and spend time presenting to my colleagues. I have chronic fatigue, migraines, and these are my day-to-day. Imagine not being able to go into the Dáil tomorrow because you have a flare-up. You're bleeding so heavily you can't stand straight due to the pain and nausea. Imagine not doing a school run, having a child's birthday party. Imagine a consultant not believing you when the equivalent pain of a ravaged ovary is being stabbed. Imagine being in so much pain you can't stand and you won't go to A&E because they won't believe you, or they'll just say it's just your period. I'm in this position now because for years and years we've been told there is nothing wrong with us and our disease has festered. Fertility and endometriosis have taken away joy, fertility, love and much more. Ireland has also not had my back. I've had zero support. Please be a government who finally take action and believe us. Get behind us, empower us, invest in us. Please don't let us down.
Thank you. Deputy Jane Cummins.
And I'm thankful to Sinn Féin for bringing forward this motion this evening, and I welcome all the people in the gallery. And yet again, here we are in Ireland, and women have to talk about the most private things in public again. And I mean, he was here earlier talking about child sexual abuse in Ireland, another secret that kept for so long. In the course of time being here, I have spoken so many times in this Dáil about issues that affect women and children in this country, and I just cannot understand how we keep repeating the same thing over and over again. I suppose we need to be looking at and seeing the effects that this has on people. And it's very hard to follow my colleague, Deputy Whitmore, the email that came out because from her constituent, because, you know, the lived experience of people is why it's so important that it's here. But having to talk about these things is so painful and probably very traumatising for people again and again. I remember reading the brilliant book Invisible Women by Caroline Criado Perez, which says that endometriosis affects 1 in 10 women, and yet it takes years to diagnose because women's pain has not and never has been taken as a priority for medical research. In Ireland, the average time to receive a diagnosis is 9 years. That's 9 years of pain, turmoil, physical and emotional, and because it's not just the agony, it's the fact that nobody's believing you that you're in this agony is so difficult for so many women. And I suppose the fact that our whole health system seems to just ignore women time and time again is compelled by the fact that it takes 9 years for a diagnosis. I suppose, you know, understanding and listening to people's stories, what I'm hearing is that it affects every aspect of life. their social life. If you're in agony, you're not going to be able to go out and enjoy yourself. So then, you know, you're not going to be able to continue your schooling, your education, your work. And it's not good enough that an employer might be very reasonable. The fact is, people should be supported and healthcare should be available in this country and not travelling abroad. And we've seen that echoed throughout healthcare for women again. And I suppose from the motion, I was so shocked that we would have to be calling for proper healthcare and surgeries and training. Like, it's 2025. Do you know what I mean? I don't know, maybe I'm just naive as a new TD thinking, oh, well, surely this has happened. But I'm just shocked that a motion would have to call for that. And I'm heartbroken for the women who this is what happens, and this is one example. I'll probably be here after the summer recess talking about another issue, and you know, I just think I'm kind of a little bit flabbergasted, as you can hear. Sorry, I'll focus again. But I suppose what I want to say is that we are just neglecting women all of the time, and this is another example. So it needs to stop. It needs to stop that women are travelling abroad. It needs to start that the medical system totally supports these women so that they can live a full life. And as somebody wrote to me earlier in an email, she said, endometriosis is not a bad period, it's a full body disease. And again, when people are saying to you, oh, it's only a bad period and you can take some aspirin, well, I tell you what, I just wonder how many people have had to hear that, and the devastation, and that you probably feel to yourself, well, maybe I am imagining it, and you start to doubt yourself. That is not good enough. Bloody hell, I'm sorry, I nearly cursed there. But like, we really, really have to get this together. And I just think everything that needs to be done. And thank you, Sinn Féin, for bringing this forward. I really appreciate it. Thank you.
Deputy Brian Stanley.
Thank you, Concorda, and welcome to our guests as well in the public gallery. The testimony from the last two speakers, and particularly Deputy Whitmore's testimony that you read out from a woman who wrote to you, I've heard similar stories, you know, maybe not as long, but you know, snippets. As a man, constituents have told me similar stories over the years, and particularly in recent years, about this problem. So, Minister, we have to stop exporting our health issues and people for treatment, and particularly women in the case of this chronic condition. Not near enough attention has been given to it. Proper resources hasn't been given to the proper treatment of it, and we have a situation here where we have what has been described to me as pain like you could never actually describe in words, that affects women's bodies, this disease. Severe pelvic pain, it affects fertility, it can cause scarring, it's very stressful, and on the monthly cycles, it's been described to me very, very clearly, you know, how that exacerbates it and how it's worse. Unbearable, several women have told me, and have described their own situations and that of their daughters to me. It also causes damage to other parts of the body, and that's been well documented, that it's not just the womb area, it's not just the pelvic area, it can affect several other parts of the body, the bowel and the kidneys and many other parts. And I have to say to you that, you know, we have a situation here where we have a disease that affects 10% of women in Ireland, and surely if there's something affecting 10% of women, we have to stand up and take notice of this. And the fact that the average waiting time is 8 to 9 years, it's unbelievable that that's happening, and how this has been let run for so many years. All the women who have come before us in previous generations who have suffered this silently. And as somebody's already said, you know, the previous deputy has said, you know, we're in 2025. This has to stop, and we have to try and, you know, put forward proper treatment, expert treatment for this very debilitating condition. Endometriosis, as I said, can cause infertility, and obviously for women and for couples trying to have a child, that presents a terrible problem for them. And the woman, unfortunately and wrongly, will often feel under pressure and blame themselves because of the condition. Many gynecologists will strive to improve services, but there are issues around resourcing. There's also an issue around theatre time for surgeries and specialised treatment. Expert-led surgery is a necessity, and we must deal with this area and improve the quality of that service for women. HSE guidelines acknowledge that this is a superior treatment for managing the condition and giving an improved quality of life. And while there is no known cure to actually prevent it from happening, many women who have proper treatment go on to live a good life when the condition is managed properly and when they get the proper care. Women have been failed for years in Ireland around this condition. And I know you have mentioned the 5 hubs, but the expertise, the level of expertise and the level of staffing and timely access, 9 years or 8 years or 5 years is not good enough. This needs to be done in a matter of months, that women can have treatment once it's properly diagnosed, from diagnosis to treatment. We have to start shortening that in this country. But my God, 9 years is appalling. So we need more surgeons in the area. There's only 25 out of 50 posts have been filled. Recruitment and retention of surgeons and clinical nurses in the field has to be stepped up, and has to be stepped up at a pace that's needed. Women often feel that they're dismissed if they're suffering, when they're suffering this, due to not being able to go to work or do social events or just participate in normal family life. And that's very distressing for them, and some of them have described that to me. While of course, you know, the situation as regards fertility creates a problem. And you know, we do have fertility clinics, and just to mention here as well that there's a factor there in terms of the waiting times for those clinics and costs. And I want to mention that while you know very welcome changes were brought in September 2023, not all couples are able to access the IVF treatment due to age or perhaps weight issues or other circumstances, and that needs to be re-examined. So the motion is calling on the government to establish a state-of-the-art centre of excellence for endometriosis care, to establish specialised imaging and protocols to assist gynaecologists in identifying and mapping and getting the information on endometriosis, to develop and fund a dedicated training and incentive programme. This also needed to be launched, Minister. It's a nationwide public health campaign to raise awareness. And we must have a situation where doctors and specialists start believing women when they present with this condition because of the chronic nature of it and the sheer number of women that endure this throughout their life. So in conclusion, we're talking about women's health, and we can't forget about those women who suffer due to the menopause, an extreme condition for some women during that time of the month, and how often this is often overlooked, particularly around those women who are working and who for many reasons have to take time off, or who struggle with mental health during that period. It can be a very emotional time for them, and we need to do better for them. I want to acknowledge in that context, Minister, and welcome the rollout since I last raised this with you of the free HRT treatment. It's an issue that I raised with you and your predecessors on a number of occasions. I want to acknowledge the fact that the government have done that, and certainly that's very, very welcome, particularly for low and middle income families and women who maybe wouldn't be able to access it otherwise. But with this condition, we need a step change, we need improvements. There's a clear action plan there to be taken, and I would urge the Minister and the Government to get behind this and not have to export women having to go to Romania or anywhere else for treatment.
Deputy Paul Lawless.
And firstly, I want to welcome the motion brought by Sinn Féin, and indeed welcome the visitors in the gallery, and welcome the Minister here as well to this very, very important debate. And I read the motion, and we fully support this motion. Indeed, we have done quite a lot of work in Aintu in relation to this, and I think it's really important that the lived experiences of so many women across Ireland are brought here to the floor of the Dáil and in front of you, Minister, as well, because the fact is that endometriosis is not a minority condition. It affects 1 in 10 women. Indeed, there are more women who suffer from endometriosis in this country than there are people with diabetes. And yet many of those women suffer in silence. Indeed, many women have endometriosis for several years. And it goes undiagnosed, Minister. So, and I want to raise the story of Holly Barr here today in the Dáil. Holly Barr is a young woman from Kildare whose harrowing journey and endometriosis experience, I think, is worth raising here today, Minister. for Holly, the delay nearly cost her her life. Misdiagnosed for over a year and told she had anxiety and depression, despite all of the symptoms, despite pain, vomiting, and digestive issues. At 26, her bowel perforated due to an undiagnosed bowel endometriosis, and she needed surgery as a result. And unless she had that surgery, she would have died. And that is how significant this is. And the idea that Holly and hundreds of other women across this country were told it's in your head is deeply, deeply wrong. And that is the lived experience of so many women across the country. They suffer in silence, they suffer, they go to their GP, they go to the A&E, and they go to the consultant in many cases. And in some cases, they're told it's in your head. And that is why, Minister, we have actively worked on this issue, and we've raised with you on so many occasions the national framework. And the national framework is a key piece of guidelines and framework that will actually provide a pathway for women, and indeed provide a pathway for GPs as well, a referral pathway that is critically important. And Minister, my understanding, and I would like you, Minister, to make a statement on this in your next exchange here in the Dáil, but Minister, my understanding is that there is great difficulty at the moment within the HSE and the GPs to bring that framework to the next level. And my understanding is that the GPs are yet to engage with the HSE in relation to this. It's critically important that is introduced. And I would like you to make a statement in regards to where that framework is now and the next steps to bring that into fruition. I want to also commend the work of my colleague in Aintu, Melissa Byrne from Kildare South, who's done tremendous work in relation to this. Indeed, we hosted the Endometriosis Association recently in Leinster House in the AV room. And I was really struck when we had the association in, the level and the volume of constituents who contacted me with really, really harrowing experiences. Indeed, many mothers contacted me as well. And the overwhelming stories that I have heard is that, and this is really concerning, Minister, what's happening to so many women is that they present with difficulties, they present with pain, and in some cases, the pill is prescribed. And that obviously has a benefit in terms of the pain, but it also has a masking impact. And as a result, there is a significant delay around the actual diagnosis and therefore treatment. And I think this needs to be seriously looked at by this framework, that, it is totally unfair that women have to wait 10 years in many cases to actually get the diagnosis that they deserve. And it's only then at that point that they can go about the treatment that they need as well. And I do appreciate this is a very difficult condition to diagnose, but it simply cannot be the answer in this country, where we simply put young women and young girls on the pill, and where they only realize that they actually have this disease. In many cases, when women are in their 30s, when they're seeking to have children, and then they realize that they have this disease. And in many cases, Minister, this is actually a huge problem, to be honest. And actually, there is a significant amount of women who undergo IVF, and through that process only subsequently realize that they have endometriosis. So, there obviously is a very significant impact as well in terms of, day-to-day, the work experience for many women. Indeed, since I raised this in Leinster House, Minister, I've had hundreds of women contact me who state that it's incredibly difficult to go about their lives during particular times of the month. So, Minister, we very much welcome this motion. We very much support this motion. But I think it's really important that the government don't just counter motion this particular. This is too important. The women here today, and I hope you get a chance to meet the Minister, listen to their experiences. It is too important an issue to simply put in a counter motion and forget about this. I want to see you address this issue with urgency. I want to see you come here before the Dáil and tell the women that are here what is happening with the national framework. Are the GPs engaging in that forum? If not, why not? And what have you done as the Minister to bring the GPs to the forum to make sure that the national framework moves to the next stage? And this is the next stage. This is what the women here in front of us want to know. This is what the future women and girls want to know. Like, it's critically important that we progress this national framework, that we get to a situation where women are no longer suffering in silence. Women should not have to wait 10, 15 years for a diagnosis. And I urge you, Minister, to engage proactively with the Endometriosis Association of Ireland, bring the framework to the next stage. And because, you know, the women of Ireland deserve it. And as I said from the outset, this is not a minority condition. It affects 1 in 10 women, more than the people of Ireland that suffer with diabetes, and yet there are so little information. There's a vacuum of information, actually, and I think that is why, one of the reasons why, and when you speak to women across the country, there's a significant variation in terms of how what their treatment pathway looks like, and that is why I'm so keen, Minister, that we progress the national framework, that we have a standardised system, and we get to the bottom of this for the women across Ireland.
Thank you, Deputy. Deputy Carol Nolan.
I certainly welcome this motion here tonight. I think it's a timely motion, and it's there to address the frustration and the chronic pain that too many women have to endure unnecessarily. I want to welcome the visitors to the gallery here tonight. It's great to have you all here. You shouldn't need to be here because this is an issue that should have been addressed long before now. But I certainly will be supporting the motion, and I feel that we urgently need to rapidly increase the level of support and the diagnostic pathways for women experiencing endometriosis. And I know from the vast amount of correspondence and calls that I've received from many women in my constituency that this issue is having major consequences in terms of women's physical, mental, emotional health, and that it is also creating real pain around fertility issues for many women. And there is a lot of frustration there, there's a lot of upset, there's a lot of anger, and I think that tonight should be the start of a change of direction, and we need to send out a message of support, and we certainly need to change the way we do things, and we need to ensure that there is centres of excellence for women, and that this diagnosis is obviously this condition is diagnosed firstly in a timely manner, and that women are supported. What I would like to see specifically is a strengthening of the multidisciplinary care framework with clear implementation timelines. Perhaps we could consider mandating the establishment of at least 2 fully staffed endometriosis centres of excellence within 24 months, each with a multidisciplinary team including gynaecologists, radiologists, pain specialists, psychologists and fertility experts. And while I note the motion did not specify annual funding allocations, I think we need to do that in order to ensure sustainability into the future. Additionally, embedding patient advocates in the planning process would ensure that centres address real-world patient needs, such as psychological support and post-surgical care. And it's so important that every approach, and particularly in relation to this condition, every approach we take must be patient-centred and informed by women themselves. I do agree that we urgently need to expand and fast-track referral system with primary care training. While the motion's proposal to end primary care's diagnostic responsibility is critical, it requires a robust and timely replacement system. And perhaps we should look at mandating a nationwide fast-track referral pathway within 12 months, ensuring that women with suspected endometriosis are referred to specialists within 4 weeks of presenting with symptoms. And you know, the stories that I'm hearing is that women are enduring this for years and years, and that it has greatly impacted upon their lives, and that's unacceptable. I think, you know, it's reasonable that you know, the referral to specialists and that it is a timely process. It has to be. And I think that's something that needs to be improved on and can be improved on fairly quickly. This system should be supported by mandatory training for general practitioners on recognising endometriosis symptoms, so using tools like Endometriosis UK Symptoms Diary to standardise assessments. I'm aware that Australia's National Action Plan for Endometriosis has cut diagnostic times by 30% through similar reforms, so certainly that's a model that could be used here. There is no doubt that we need to introduce an enhanced public awareness campaign with target metrics and community engagement and direct engagement from the women themselves that are affected. A fully budgeted 3-year campaign launching within 6 months, targeting schools, workplaces and community groups to educate on endometriosis symptoms and the challenges would be a start, and obviously challenging the whole stigma. And I think that would send out a message of support to so many women who, you know, are not being given firstly a diagnosis or support regarding their symptoms, or they're being misdiagnosed in some cases. But I think it would show that we support them, and we'd send that message through a campaign. Garv Magat.
Deputy Danny Healy-Rae.
I'm glad to get the opportunity to talk on this very important motion. I want to thank Sinn Féin for bringing it before us here tonight. I want to welcome all the people to the gallery that had to come here, all the girls and women, and we're sorry that you have to come to highlight your condition and your problem, but why not? Because you're very welcome here, and it's sad to hear and see that what you have had to suffer. And when we see a figure like 10% of women, I mean, if it was only 2% of women, it would be still too much. I mean, pain, or anyone suffering pain, that's absolutely a no-no, and we should do everything possible to ensure that any women that present with this endometriosis is seen after as a priority. And I was appalled when I had someone of the speakers here saying that people are often frowned upon, that is in their head, or that they're only imagining it. That's not right. And when there's so much people presenting with it, you'd think that the GPs would be more informed and understand all the different conditions that would suggest that it is endometriosis. I'm appealing to you, Minister, you're a woman, and Minister Troy beside you, and the government, to do whatever is necessary to see after these people. It galls me to hear that maybe people in times gone by, women in times gone by, had to suffer pain when families depended on the mother so much and the woman in the home, and we all do, and we have to appreciate them and see after them. And look, this is a very serious thing. You have to prioritise it, ministers, and ensure that whatever is lacking or whatever is falling down, or where we're falling down in our, whether it is our GPs, whether it is our consultants, whether it is our hospitals or whatever, this has to be prioritised. It is going on for long enough. When we hear that the women that came before us suffered in agony and suffered in pain and suffered silently, that's terrible. I feel for anyone that has pain, and it happens from time to time, and I know people that passed on suffering fierce pain, and it is the last thing that we want to hear is anyone suffering in pain. And it's not fair with all the things that we have today and the affluent society that we have. this matter will have to be seen after and taken care of. And again, Minister, you're a woman in Cabinet, and we're looking up to you to sort out all of the health problems. But I'm asking you to prioritise this endometriosis problem that the women have, and to sort it out as soon as you can. And I'm appealing to you not to oppose this motion or think of any other amendment. We have to work together to ensure that this is sorted out, and that all these girls here, there and everywhere there's a woman that if they're suffering and this is needs to be treated, it should be treated first and foremost, and ensure that we get better, move on from the times that people were suffering in silence. Again, look, there's other speakers.
Thank you. And that concludes our speakers. We're back to the government, and I call on Minister Robert Troy.
Can I speak for 1 minute?
Sorry,
am I entitled to speak for 1 minute, or are we agree with that?
You can share with Minister, but well, it's not the normal. But if you wish to, if the ladies in the gallery, it is at my discretion if the Minister wishes to address, but it will be the shared time with Minister Troy. There'll be no extra time if you wish to speak. On behalf of the ladies in the gallery, this is a very, very important topic, and I think you appreciate that. So you don't have an objection. Thank you. Minister.
I greatly appreciate that.
It's a 10-minute slot, Minister.
I greatly appreciate that, Ken Corla, and it is most unusual for a member to be allowed to speak a second time, so I greatly appreciate it. And it is to answer, to move the amendment, which I do very reluctantly, and the only reason that I do so is because, and I don't wish to criticise the motion which has been put forward in the best of faith by Sinn Féin, but there are a number of parts in it which we cannot allow to stand on the Dáil record, which are specifically clinical decisions, which are very important and may be relevant in many cases, but not all cases, and are absolutely for the discretion of clinicians in the field. And there is some contradictory elements around not wanting women to choose, but also travel abroad, but also providing funding for women to travel abroad. So I don't wish to be at odds or disagreement, and as Deputy Healy-Rae said, I don't wish to be in any way at odds with the House on this, but neither can I allow clinical decisions to be on the record of the Dáil. I think it's also important to recognise that, and I don't wish to speak across or speak to across Minister Troy, whose voice is just as important as anybody else in this House, who is a male minister in the House, and I appreciate your discretion. Ken Corla.
Thank you, Minister.
She was given the discretion, which is unique, to speak twice. Can you explain what clinical decision that you have an issue with?
Yes. Thank you, Deputy Doherty.
This is absolutely... I thought that you were going to be a bit humble and actually believe the women and be a bit respectful, but actually stand up with this nonsense.
Maybe Minister Troy will address the issue. Minister Troy. The rest of the time is yours, Minister.
Ken Corla, I thank you for facilitating me to speak here today, and I welcome the visitors in the Dáil gallery. I recognise the profound and adverse impact that endometriosis can have on the life and health of women affected by this chronic disease. It is one of the most common gynecological conditions in Ireland, and difficult to determine exactly how many women are impacted. I thank the people who contributed to the debate so passionately tonight. There is a long pathway to diagnosis for many women, and long-term follow-up care, including specialist pain management and psychological support, may be required. Recognising the wide-ranging impact of the condition, multidisciplinary teams have been established to deliver holistic, women-centred care. These include specialist.
I'm sorry.
Specialist consultant roles.
Minister, excuse me, Minister. Stop the clock, please. Deputy. This is a debate. There is a structure and a format. Out of respect for the visitors in the gallery.
I am the only person.
Excuse me while I'm speaking, Deputy, please. I just let the Minister, you have 10 minutes afterwards as a party. Let the Minister speak uninterrupted for the benefit, or not, as the case may be, but allow the people to hear the debate, please.
Well,
Thank you.
Watching the reaction in the gallery, because they know as
Sorry, Deputy, you know what you're doing now is wrong, so I'd ask you to stop interrupting the Minister, please. Minister, continue. Restart the clock, please.
This is where we are going with it. These will include specialist consultant roles in colorectal, urological and radiology, along with women's health physiotherapists, dietitians, psychologists, specialist nurses and healthcare assistants. Recruitment for these funded posts is actively ongoing to further expand specialist capacity. The Minister for Health and the Government are committed to promoting and improving women's health outcomes, including the expansion of specialist services in endometriosis. Our commitment is spelled out very clearly in the programme for government. And I accept some people wish the programme for government to be implemented, a 5-year programme for government to be implemented in 5 or 6 months, but that is not possible. The HSE National Women's and Infants Health Programme has led on the development of the National Endometriosis Framework and on the expansion of existing endometriosis services. The HSE has advised that they have shared an agreed framework with the IMO on the 7th of July just gone by. Alongside the development of specialist treatment centres, working is also continuing in education and training in reducing the threshold for investigations for suspected endometriosis, in raising the index of suspicion, all of which will go towards reducing the time for diagnosis and treatment. The diagnostic criteria for endometriosis are determined by clinical experts in the field. The clinical guidelines and the framework emphasise individualised women-centred care rather than a rigid staging approach to determine the extent of disease. GPs are encouraged to initiate treatment for suspected endometriosis and then to refer for secondary care for leprosy if symptoms are severe. This referral pathway is the same for all specialist health services in Ireland. While the national framework for endometriosis is still being finalised before publication, it is important to note that specialist services in regional hubs and super-regional sites are operational and taking referrals. The defined clinics at Galway and the National Maternity Hospital, while accepting referrals, are not yet fully developed to the same level as other hubs. Services are expanding as recruitment progresses for the outstanding posts. I'm advised most women referred to specialist endometriosis services and gynaecology services are seen within 6 months. I do accept that previous speakers have said this is not the case, and the Minister has taken on board the views that I've expressed here this evening and will look into this further. These services are being continuously expanded as recruitment continues with funding provided this year. I know many of the posts that have been funded are not yet filled. Most of these unfilled posts relate to new funding allocations in 2024 and 2025 to expand our existing endometriosis service. The HSE recruitment process is in progress for these 18.6 whole-time equivalent recently funded posts. 47% of women impacted by endometriosis will also have fertility issues relating to the condition. Fertility care has also benefited from targeted investment from government. There are now 6 regional public fertility hubs across Ireland. These hubs accept referrals from GPs directly and from consultants. This system ensures early access for women with suspected or confirmed endometriosis who are exempt from the standard referral criteria. This integrated model allows for streamlined cross-referrals between fertility and endometriosis services, ensuring women receive timely and appropriate care based on individual needs. The HSE has identified a holistic care package for women suffering from endometriosis. Multidisciplinary teams, including clinical nurse specialists, dietitians, physiotherapists and psychologists are being funded to provide a holistic service. I'd also like to recognise other developments in the provision of gynaecology services that will support women's healthcare provisions. 18 gynaecology see and treat clinics already operational, with more in development. 6 specialist menopause clinics are currently operational for those women who require complex specialist care in menopause. 6 regional fertility hubs will provide support to the estimated 47% of women with endometriosis who will also experience related fertility issues. To support the implementation of the national framework, the HSE has established an endometriosis professional network to help drive a standardised approach to endometriosis service delivery and care. The HSE National Clinical Guideline for Management of the Endometriosis was also published in March this year. Training of medical specialists in the management and diagnosis of endometriosis forms an integral part of the specialist medical training programme provided by the Institute of Obstetricians and Gynaecologists. The Irish College of General Practitioners also provides education regarding endometriosis to its members, including delivering a blended modular course in community gynaecology in which endometriosis is included as a mandatory topic. Endometriosis is also listed as a core component of the women's health portion of the postgraduate GP training curriculum. The HSE are planning an awareness campaign following the publication of the framework. This campaign will focus on highlighting the wide range of signs and symptoms of disease and promote the services available and the associated care pathways. The HSE are also developing a comprehensive patient information resource that will be made publicly available online. As the Minister for Health advised, the programme for government is committed to continuing to expand specialist service in this area. There has been investment of over $5 billion in the provision of these specialist services to build up a national framework and a model of care for endometriosis. This is very much the beginning, but it is clear from listening to the contributions here tonight that more work needs to be done to continue and to broaden this support for women suffering from the impact of this life-changing condition. The government is committed to promoting and improving women's health outcomes. In recent years, there has been significant investment to improve, reform and stratify our gynaecological services. This process is ongoing and includes the development of gynaecology clinics, specialist menopause clinics, regional fertility hubs and endometriosis clinics. Through the continued implementation and establishment of these services, our model of gynaecological care and the focus on women's health is being changed for the better to meet the needs of women accessing these services.
Thank you. Deputy Shona Nirali.
The courageous women in the gallery tonight who've bravely shared their stories with us today and over the last number of months. Women who have been forced to travel abroad due to the neglectful health system of this state. A system that has told young girls to get pregnant to stop their periods, allowed their mothers into debt seeking treatment abroad, a system that has referred our women to mental health services instead of gynaecological ones because it's all in their head, a system that allows women to go into septic shock on the floor of a hospital waiting room, all while there are state-of-the-art facilities available across Europe. A constituent in South Kildare wrote to me recently, like so many other women, when Sheena first made contact with our health system because of excruciating pain, she was told that that was normal. Her experience dismissed outright. After seeing 4 specialists and paying $3 grand out of pocket, she finally got a diagnosis. In that time, she's had to leave work, and on numerous occasions, her partner and children looked on helpless and sick with worry. She was left in the dark by doctors about a string of other related symptoms. The only insight and guidance she received was from women like herself in online forums. She counts herself one of the lucky ones. Another constituent endured 9 IVF procedures and 2 miscarriages before receiving treatment abroad. And yet another constituent emailed me just today to tell me that she waited 20 years for her diagnosis. This is absolutely shameful. We need to take a long, hard look at ourselves and the system of care that we provide women in this state. Women are told to put up and shut up by a system indifferent to their suffering. It's high time we start taking women's pain and women's health seriously. We have a horrifying track record in this respect, stretching back to the foundation of the state, and it is a living history. With the recent collective trauma of the cervical check scandal hanging over Manana Heron, along with a litany of other injustices, including HRT shortages, lack of proper menopause care, ADHD misdiagnoses, there's a moral question that must be deeply considered. For just how long is this government willing to let women suffer? Women with endometriosis are simply in too too much pain to fight this fight alone. Tá sé anam inestíocht ceart a dhéanamh I gcuireadh sláinte na man in éireann. Ní féidir le neamhord a dhéanamh a bhfollingt a thuilleadh.
Thank you, Deputy Féin O'Sullivan.
Gurmata chun córa fáilte roimh man anna héirna tá hús an teanach tá céad mhaile fáilte roimhse. Like most men, Minister, I knew very little about the silent problem of endometriosis until we held a meeting in Arklow recently for the Wicklow-Wexford constituency, and certainly it was an eye-opener for me. I'm sure it would be for most men and for many women as well. We heard so many heartbreaking stories, one after another, of women not only having to battle with chronic excruciating pain, also having to endure the trauma of having to fight for a diagnosis in the first place, fight to be listened to and fight for adequate treatment. That's simply not good enough in 2025. No one should be forced to fight to be believed, to be diagnosed or to receive proper care. The Arklow meeting was full of harrowing accounts from women who had been suffering in silence. We had stories from 3 generations in one family, mother, daughter, grandmother, granddaughter, such as my own political assistant in my office, Nicola, who was from County Wicklow. She spoke of her symptoms from her early teens and had her first surgery at the age of 16. 5 surgeries later to laser off the endo. She was told to have a child at the age of 22, as this might help, she was told. However, she ended up losing her ovary to endometriosis in her early 30s. Nicola's mother, Phil, as a young woman, suffered constant pain, and like many other women, she was told, sure, it's only women's problems, could you get on with it there now? So at 34 years of age, she had a full hysterectomy after being diagnosed with endo, and it was that bad that when they opened her up, they could not find her womb, and the endo was covering her bowels as well. So she's now age 69, still suffering because of endo, which is this unspoken disease that we're supposed to believe is non-existent. Sadly, nothing or very little has changed in 40 years. My PA's daughter, Sarah, also suffers severe pain, bleeding 3 weeks every month, and the experts, I suppose in inverted commas you could say, would not listen to her or her mother despite knowing their history. At the age of 18, she got off the dart, went to the A&E, sat there until she was listened to, and got diagnosed with endo, had a tilted womb and a sister condition, adenomyosis. She went back at the age of 25 and was still having problems, but was told recently, you don't have that either. So at the meeting we heard many similar stories from County Wexford and maltreatment and young women rendered fertile from it. So I suppose it's time, Minister, that we need to end the suffering, end the silence, stop exporting this problem and build our own centre of excellence, because it's affecting 1 in 10 women, and this is the very least that they deserve.
Thank you, Deputy Cathy Bennett.
I'd like to welcome all the ladies in the gallery today who have suffered long enough. I'd like to thank Senator Maria McCormick, who has travelled the length and breadth of this country to be informed of endometriosis. I have said in this House before that this state has a sad history of failing women. This government continues to fail women today in terms of diagnosis and care for those with endometriosis. It is accepted by clinical specialists that the true prevalence goes beyond 1 in 10 women officially, but of a failure to diagnose and a failure of a minister to act and a failure to believe in women when they say that they are in pain. These failures have led to 9-year delays in women being able to access adequate treatment. Sinn Féin have hosted 9 meetings across the state, and the stories told by women have been harrowing. Women dismissed and not believed and told to go to invisible endometriosis hubs. Women have been told to do this that have travelled to England. Why would they do this if the treatment was here in our own country? What has been apparent at the Sinn Féin's public meetings is that endometriosis does not simply impact upon women. It impacts upon families, it impacts upon quality of life and intimacy, it impacts upon planning for and for having children, it impacts upon people's ability to get an education and to work, with 95% of respondents to a Sinn Féin survey indicating that they had missed such commitments. Sinn Féin recognise these impacts upon women, families and our society. That is why our motion tonight calls for a dedicated, multidisciplinary disciplinary endometriosis treatment centre to be staffed and resourced to provide diagnostic and holistic management and specialised excision surgery. We want to see a gold standard surgical mismanagement for this agonising condition. Unfortunately, the government's amendment tonight represents anything but that. I am, in fact, disgusted by it. With reference to women who choose to avail of private treatment abroad. Minister, women do travel abroad for healthcare for chronic conditions, but they do not travel abroad to enjoy this as a trip. They do quite literally for the good of their health, because they have been failed by your health service. I call on all deputies to support this Sinn Féin motion, and Minister, you should withdraw such a callous and uncaring amendment and listen to the stories of many women that are suffering immediately.
Deputy David Cullinan.
Ministers, never have I seen a debate where the Minister's speeches were so far removed from the reality of women and their experiences. And I watched in the public gallery as women got very angry when they listened to the Minister's speeches, and in fact many of them were in tears, and rightly so, because for so long these women have felt ignored and they have felt dismissed. And I would wager at bet, Minister, that they feel ignored and dismissed by your responses here today as well. You said in your opening statement that women are cared for at the most appropriate level of intervention, beginning with primary care by GP to local hospital care to specialist hospital care. The reality, Minister, is that for the vast majority of women, primary care and local GP is not the best option. In fact, that's where many of them were failed. You don't actually say anywhere in your speech that local hospitals have also failed, and I don't blame the staff in those hospitals because they simply haven't been trained. But again, women have had bad experiences where they've gone to hospitals. You then talk about specialist hospital care, and for women who we talk to, the special hospitalist care doesn't exist. And when you then go to your speech, Minister, where you say some women may also choose to avail of private treatment abroad. Now, I don't know any woman that would choose to go abroad for invasive treatment by choice. The reason why they go abroad is because the very specialist treatment that you talk about in your opening statement simply doesn't exist. And what we call for in our motion here today is for a centre of excellence, supported by regional centres, but one centre of excellence where women can get the gold standard. The reason why women travel is because the gold standard isn't available. So I'm afraid, Minister, when you were accused earlier of gaslighting women, I have to say I stand over that, because that's how those women will feel.
Thank you. Thank you, deputies. And that concludes the debate, and the question is now that the amendment be made. Is that agreed? Not agreed. Not agreed. Deputies in favour say thaw. Deputies against say kneel. Kneel. In my opinion, the question is carried. And that division is deferred until the weekly division time tomorrow evening. Thank you, deputies. We now move to priority questions on finance. Minister. Thank you.